Lateral elbow tendinopathy and lateral elbow pain. The elbow is a much more complex region than people give it credit for. Anatomically, the elbow is a joint formed by three bones: the radius, ulnar, and humerus. The elbow joint moves as a hinge joint, but importantly, there is a smaller joint that communicates with the main elbow joint called the radiocapitellar joint, which allows for forearm rotation. This rotation is crucial to human upper limb function and allows us to rotate the hand into different positions so we can grip, grapple, and manipulate objects. When we talk about lateral elbow pain, most people think about tennis elbow. The average duration of pain with tennis elbow is 12 to 18 months, which can be extremely frustrating. When a problem is very recalcitrant like this, often there's something we've missed or other factors contributing to the pain. It's important to realise that there are multiple structures in this area that can be responsible for pain, and often they overlap. While the extensor tendons of the elbow are the most common cause of pain in the area, it's important to get an accurate diagnosis, especially when symptoms are prolonged, because the right tools are needed to target the right problem. Another cause of persistent lateral elbow pain includes posterior interosseous nerve, or PIN entrapment, as it runs into a deep muscle in the forearm called the supinator. This tends to cause some radiating pain and tenderness around the nerve down the back of the forearm, and more weakness with lateral elbow than with lateral elbow tendinosis alone. Pain can also come from the biceps tendon. People think of the biceps as the big muscle at the front of the elbow, but in fact, its tendon, as it goes toward the elbow, spirals under the radius bone to attach on the undersurface, and this can certainly create pain toward the outer part of the elbow. Finally, the underlying radiocapitellar joint can be a source of pain, usually when there's some cartilage wear in there, and usually in people who have had previous trauma or fractures around the elbow. Diagnosis. A comprehensive clinical examination and often more advanced imaging is helpful to accurately define sources of pain, and hence the best individualized treatment for each person with lateral elbow pain. Treatment. When lateral elbow tendinopathy is confirmed, we focus on activity modification and gradual tendon strengthening. The tendon needs to be challenged not only with its extensor function, but also with its grappling, twisting, supination function, which is why I usually recommend the use of a flex bar with progressive resistance training. With all tendon pain, it's very important to understand that the pain is not proportional to tissue damage, and that the relief of pain is in fact not proportional to any healing that may be happening. So what we focus on is the capacity of the tendon to take load, and as this improves, the pain improves regardless of the changes that we see on high resolution ultrasound or MRI. Therefore, the focus is to help desensitize pain to promote the ability to perform strength exercises. A counterforce brace can be a helpful tool early on, and isometric exercises where a lower level of tension is held in the muscle for a longer time can also help for the pain. Changing lifting technique to ensure that the leverage on the elbow is minimized can also help reduce elbow aggravation during daily activities. A consistent strength program targeting the extensor supinator compartment is really the most important treatment, but sometimes adjuncts are needed in order to reduce the pain and sensitivity. Platelet-rich plasma injections at the point of where new abnormal nerve and blood vessels ingrow into the tendon can markedly improve pain, and they're in preference to cortisone injections, which have previously been shown in research settings to prolong symptoms and duration of symptoms when compared to physiotherapy treatment alone.
I hope you found this video useful. I create these educational videos to help empower patients by allowing them to understand their problem treatment options, and the expected recovery. Please remember, this lecture is for educational purposes only, does not constitute the giving of medical advice, and no patient-doctor relationship is formed.